I am a nurse.
I am a nurse.
I am a nurse.
And I am a nurse, and I'm proud. It's made me feel really proud to be a nurse.
And to be in the same category as the NHS heroes that have worked throughout the pandemic.
It's not just a job, it is a vocation.
Ultimately, we're here to improve patient outcomes, and you can see the effect that the pandemic has had on the staff and working closely with staff in the hospitals.
The camaraderie of nurses, I've seen such a big change in how nurses have come together and really pulling and caring about each other, as well as the patients that they're looking after.
We all sort of stepped up and rolled our sleeves up and helped with cleaning down beds and mattresses, offering training, doing extra hours just to help the field hospitals and support the NHS as best as possible.
And the nurses are really so passionate about what they do. They've worked through such hard times, and it makes me really proud.
And looking at all my colleagues and how they've gone over and above to support the NHS and all the patients that have been suffering, it does make me feel really proud to be in the profession that I am in.
So we've been limited to how we've been able to get onto the wards because of the pandemic, and obviously certain wards have had COVID outbreaks.
And obviously we've not always been able to get next to patients and help with the training to make sure that the patients are on the right product for what they need.
It's made us as a company really think more about how we can get our training across to the nurses, because the products are only as good as the people that are using them.
Medstrom have utilised the QR training codes, which we've then utilised in our hospitals and have been used widely and really well, so staff have got access to those training videos so they know how to use the equipment appropriately.
And obviously we've always got the 24-hour helpline where we can offer support down the phone as well.
When there is a really complex patient, we've been able to offer something that will help them to improve their outcomes and to help with their discharge, so freeing up the hospital and the ward environment. But also we've been able to continue that throughout into the community.
And to ensure that the right patient's on the right product at the right time.
You should be so proud of yourselves and what you're doing, and the fact that you've gone through 3 waves and you're still smiling, you're still continuing on the wards as normal.
I go into intensive care units now, and just even now we still need to tell them how precious they've been to us and what a fantastic job they've done over the last 12 months.
And we're still seeing wonderful patient outcomes, even though there's been a global pandemic on.
Their job's been so difficult, and it's not just about them coming to work. They've had to deal with this along having family lives as well.
And I feel very proud to be part of, or a small part of that nursing team.
It's overwhelming to see how everybody's just stepped in and worked together to get through this all. Keep going.